Feeling tired all the time? Don't brush it off as just aging. On Wellness 60 to 100, your trusted source for healthy aging, we reveal how persistent fatigue may be more than low energy. It could be your body's early warning sign of cancer. Let's uncover what your exhaustion might really mean. Helen, a 69-year-old retired nurse from Arizona, had always been full of energy. She stayed active, walked daily, and volunteered at her local library. But over a few months, things changed. She felt constantly drained, even after a full night's sleep. Simple tasks like grocery shopping or folding laundry became exhausting. Her family reassured her, saying, "You're just getting older." Still, Helen knew something didn't feel right. She wasn't sick. She hadn't changed her routine. So, she insisted on seeing her doctor. Blood tests revealed something no one expected. Helen had early-stage leukemia. Her fatigue was one of the first signs. Because it was caught early, she began treatment right away and avoided serious complications. Helen's story is a powerful reminder. Chronic fatigue is not a normal part of aging. When your body keeps sending the same low-energy signal over and over, it's time to listen. Sometimes, it's not about being tired, it's about being warned. I'm Dr. Emily Carter, a board-certified geriatrician. Many people believe feeling tired all the time is just part of aging, but that's not always true. Persistent fatigue can be the first sign of cancer, especially blood cancers like leukemia or lymphoma. In this video, I'll help you recognize when tiredness is more than just getting older. Tiredness is common, but when it becomes chronic and unrelenting, it may be your body's way of signaling a deeper issue. On Wellness 60 to 100, your trusted source for healthy aging, we're diving into how persistent fatigue after 60 can sometimes point to hidden cancers, especially blood-related ones like leukemia or lymphoma. Fatigue is often one of the earliest and easiest to miss symptoms, long before pain, weight loss, or fever appear. This episode will show you how to tell the difference between normal tiredness and something more serious. Early recognition can mean early diagnosis, and that can save your life. Don't ignore what your body's trying to tell you. We all feel tired from time to time. But when that fatigue becomes constant, lasting for weeks or months, it's time to stop blaming age and start asking questions. Chronic fatigue in adults over 60 is often brushed off as a normal part of aging. Many assume it's due to retirement routines, sleep changes, or slowing metabolism. But persistent exhaustion, especially when it interferes with daily activities, could be a red flag for something more serious, including cancer. Unlike temporary tiredness, chronic fatigue doesn't go away with rest. You may feel wiped out after light activity, struggle to concentrate, or experience physical weakness even after sleeping well and eating right. These symptoms don't just affect quality of life, they could signal that your body is under internal stress. Fatigue is one of the most common early symptoms of cancer, particularly blood cancers like leukemia, lymphoma, or multiple myeloma. It may also be linked to colon cancer, ovarian cancer, or other conditions where tumors interfere with blood production, oxygen delivery, or immune function. What makes fatigue especially dangerous is how easily it's dismissed by both patients and doctors. It's vague. It's nonspecific. But that's exactly why it must be investigated. In many cases, early detection of cancer comes not from pain or weight loss, but from a persistent feeling that something isn't right. Fatigue is often that feeling. It's your body whispering before it starts to scream. If you're over 60 and feel consistently drained without an obvious reason, don't ignore it. Bring it up with your doctor. Ask for blood tests. Track your symptoms. Chronic fatigue is common, but it's not normal. And sometimes, it's your first and only chance to catch a serious illness before it's too late. Fatigue is one of the most overlooked symptoms of cancer, especially in older adults. It's not dramatic, not painful, and not specific to one disease. But it can be a powerful early clue when something serious is happening inside the body. Certain types of cancer are more likely to cause persistent, unexplained fatigue, sometimes before any other symptom appears. 1. Leukemia. This blood cancer affects the bone marrow, where blood cells are produced. As abnormal white cells multiply, they crowd out healthy red blood cells, leading to anemia and reduced oxygen delivery to tissues, causing deep, ongoing fatigue. Many seniors with leukemia report feeling wiped out weeks or months before diagnosis. 2. Lymphoma. Both Hodgkin and non-Hodgkin lymphoma affect the lymphatic system. Fatigue is one of the earliest symptoms, along with swollen lymph nodes, night sweats, or unintended weight loss. The immune system becomes overactive in response to cancer, which also contributes to exhaustion. 3. Multiple myeloma. This cancer of the plasma cells disrupts the production of healthy antibodies, weakens bones, and causes anemia. Fatigue from myeloma can be severe and is often dismissed as age-related weakness, until bone pain or kidney issues emerge. 4. Colorectal and stomach cancers. Chronic internal bleeding, even small amounts, can cause iron deficiency anemia, which leads to ongoing fatigue long before other symptoms like abdominal pain or changes in bowel habits appear. 5. Ovarian or pancreatic cancer. These are often silent killers. In many cases, fatigue is the only symptom until the cancer has progressed. Unlike temporary tiredness, cancer-related fatigue doesn't improve with rest and gradually worsens. If your fatigue is persistent, unexplained, and impacts your daily life, it's time to ask your doctor for further testing, especially if you're over 60. Don't wait for dramatic symptoms. Sometimes, fatigue is the first, and only, warning your body gives you. Everyone feels tired sometimes, after a poor night's sleep, a stressful day, or a big family event. This kind of tiredness is temporary, improves with rest, and has an obvious cause. But chronic fatigue, the kind that lingers for weeks or months, may be a different story, especially for older adults. So how can you tell the difference between normal tiredness and something more serious? Normal tiredness tends to be linked to a clear reason: poor sleep, stress, overexertion. Improve after rest or a few nights of quality sleep. Come and go rather than being constant. Not interfere significantly with daily tasks. Concerning fatigue, on the other hand, often persists for more than 2 to 3 weeks with no clear cause. Doesn't improve with rest or sleep. Feels more like physical weakness or heaviness than mental tiredness. Interferes with basic routines like cooking, walking, or getting dressed. May be accompanied by other subtle signs: weight loss, low-grade fever, night sweats, or pale skin. In older adults, it's easy to attribute fatigue to aging, but that assumption can be dangerous. Sometimes, chronic fatigue is the body's only early warning for conditions like cancer, heart failure, thyroid disease, or serious infections. Another red flag: if you find yourself withdrawing from activities you once enjoyed because you just don't have the energy, don't ignore it. Your doctor may begin with a full physical exam, blood tests, and lifestyle review. But if nothing obvious appears, insist on further evaluation, especially if fatigue is affecting your quality of life. Being tired isn't always benign. When fatigue lingers, worsens, or feels different, trust your instincts. Your body may be whispering a warning before something more serious develops. If you've been feeling tired for weeks, with no clear reason, it's time to get answers. The good news? Doctors have a wide range of non-invasive, affordable tests that can uncover what's going on beneath the surface. When it comes to chronic fatigue, identifying the cause early can lead to life-saving interventions. Here are the most common tests your doctor may order. 1. Complete blood count (CBC). This basic test checks for anemia, infection, and blood disorders. A low red blood cell count may explain fatigue and can point toward internal bleeding or cancers like leukemia. 2. Comprehensive metabolic panel (CMP). This test measures blood sugar, kidney and liver function, electrolytes, and more. Fatigue can stem from high calcium levels, liver dysfunction, or blood sugar abnormalities. 3. Thyroid function tests (TSH, T3, T4). An underactive thyroid, hypothyroidism, is a common and treatable cause of fatigue in older adults. This test is crucial and often overlooked. 4. Iron panel and ferritin. Low iron stores, often due to internal bleeding, can cause severe fatigue. This panel can help detect iron deficiency anemia, which may be a clue to colorectal or stomach cancers. 5. Vitamin B12 and folate levels. Deficiencies in these vitamins can lead to nerve damage and exhaustion, especially in seniors with absorption issues. 6. Inflammatory markers CRP/ESR. Elevated levels can indicate hidden infections, autoimmune diseases, or cancer-related inflammation. 7. Chest X-ray or abdominal ultrasound. If lab work suggests organ stress or abnormal results, imaging may reveal tumors or enlarged organs. 8. Cancer-specific markers, e.g., PSA, CA125. Depending on your symptoms and history, doctors may run targeted blood tests for cancers common in your age group. Early testing leads to early answers. Don't accept "you're just getting older" as a diagnosis. If your fatigue feels wrong, insist on a thorough evaluation. Your energy could return, and your life could be saved. If you've been feeling exhausted for weeks, even after improving your sleep, managing stress, and staying hydrated, don't wait any longer. Chronic fatigue that won't go away isn't just frustrating, it may be the earliest sign of something serious. But taking the right steps now could not only restore your energy, it could save your life. Step 1. Track your symptoms. Keep a fatigue journal for at least 2 weeks. Note when you feel the most tired, how long it lasts, what makes it worse, and whether it interferes with your daily activities. This gives your doctor a clearer picture of your health. Step 2. Schedule a full evaluation. Tell your primary care physician you're experiencing persistent, unexplained fatigue. Be firm, request blood work, including a complete blood count, thyroid panel, iron studies, vitamin levels, and cancer markers if appropriate. Step 3. Don't ignore subtle clues. Even if you're not losing weight or feeling pain, fatigue alone is enough reason for testing. Watch for other quiet red flags: night sweats, pale skin, lightheadedness, or shortness of breath. Step 4. Seek a second opinion if needed. If your doctor dismisses your fatigue without investigation, don't settle. Advocate for yourself. You know your body better than anyone. Step 5. Prioritize follow-up care. If test results are abnormal, even slightly, follow up quickly. If they're normal but you still feel off, continue pursuing answers. Conditions like leukemia or lymphoma may not show up in early tests but can become clearer over time. Lastly, trust your instincts. Fatigue may seem invisible, but it's a very real signal that your body is struggling. And in many cases, early action leads to early diagnosis and far better outcomes. Don't ignore your exhaustion. Your body might be asking you to save your own life. Brushing off chronic fatigue as "just getting older" can lead to devastating consequences. Many cancers, especially blood cancers, start silently, with fatigue as the only early symptom. Ignoring it allows disease to progress undetected until it reaches an advanced stage, when treatment is harder and outcomes are poorer. By the time more obvious signs like pain, weight loss, or bleeding appear, the window for early, life-saving intervention may have already closed. Seniors who delay seeking care risk missed diagnoses, avoidable suffering, and shortened life expectancy. Fatigue is never just fatigue if it lingers. Listening to it early may be the key to catching cancer before it catches you. As a geriatric physician, I've seen too many older adults ignore ongoing fatigue, assuming it's just part of aging. But when tiredness lingers for weeks, disrupts your daily life, or feels different than before, it's time to act. I encourage you to schedule a full evaluation with your primary care provider. Ask for blood tests that check for anemia, thyroid issues, vitamin deficiencies, and possible signs of cancer. Don't hesitate to bring up subtle symptoms like night sweats, weight changes, or shortness of breath. These small details can lead to big answers. Most importantly, trust yourself. If your fatigue feels off, keep pushing until you get clarity. Early diagnosis saves lives, especially when cancer is the cause. Fatigue is your body's alert system. Don't silence it with assumptions or delay. Listen, investigate, and take control of your health. Your future depends on it. Dr. Emily Carter. If you found this video eye-opening, don't keep it to yourself. Like, comment, and share to help others recognize the warning signs of hidden illness. And make sure to subscribe to Wellness 60 to 100 for trusted, life-saving insights on healthy aging. Hit the bell so you never miss another signal your body might be sending.